Salem Animal Hospital. I'm Camille Laws, a certified technician, and today we're going to be doing a dental cleaning on my dog Delilah. So we've placed the catheter and we've given her a pre-med. We're getting some vitals before we put her under anesthesia. And we're going to go ahead and induce and put her under anesthesia off of camera just so we can keep an eye on her. So, see you here in a few minutes.
Alright, now that Delilah is anesthetized, we can take a good look at her oral cavity and we can see that there's quite a bit of tartar affecting all of the teeth. And so what Camille's now doing is she's taking some tools to try to remove that tartar. We manually remove all the pieces that can come off till we can get the teeth as clean as possible, and then we will use the ultrasonic cleaner to get some of the smaller, more adhered tartar from the teeth. Now switching gears, Camille has the ultrasonic cleaner and she is removing some of the tartar that we could not get off with the kind of the crunch technique. And you'll notice that she's moving fairly quickly, and she's moving quick because she doesn't want to damage the enamel on the teeth. That ultrasonic cleaner does have that potential if you don't know how to use it appropriately. And so she's cleaning the outer surfaces, the tips beneath the gum line, and she's getting every single one of the teeth. So she's doing a very, very thorough job here on Delilah today. Okay, so now that we have manually removed the tartar and we've ultrasonically cleaned the teeth, we're now putting a polishing compound on all the surfaces of the teeth. And you will see here shortly that Camille will take a polishing brush and we'll go ahead and clean all of the surfaces, and then we will follow this up with a fluoride application. And last but not least, Camille is applying the fluoride. We'll leave that sit for just a little bit and then rinse it off, and we'll show you some after pictures.